Cardiac Issues by Dejanay Moore. Cardiovascular disease influences. Cardiovascular disease consists of stroke, heart failure, cardiac arrhythmias, and artery disease, which is the leading cause of death in the United States and the world. Each year in the United States, there are about 600,000 individuals that die from heart attack and stroke, which are 800,000 individuals. There are major behaviors that contribute to heart attack and stroke, which are obesity, diet, cigarette smoking, and sedentary behavior. For individuals who are already diabetic, have hypertension, and elevated cholesterol levels, when they do not care for these conditions, it puts the individual at risk. There are also individuals who are dealing with psychological factors, such as anxiety, depression, social isolation, and stress that will put the patient at risk for cardiovascular disease. Also, there are geographic disparities across the U.S. with people who have lower income in inner and rural cities, ethnic minorities, and lower income. These individuals have a higher rate of death from this disease. In rural and inner cities, there is a lack of access to health care for preventative care and lower quality. Moving forward, cardiovascular disease risks in African American women. A recent study showed racial disparities between African American women and whites. The American Heart Association recognizes that there is a huge concern to lower heart disease. Lifestyle and behavior changes can reduce risks, which are influences from one's environment, which is known as a main target for prevention. Neighborhood support is also another influence that can raise improvement in cardiovascular disease. This kind of support can also lead to improvements in other risk factors. Moving forward, behavioral interventions for obesity in children and adults. Obesity is a huge concern for both children and adults. It affects children by 17% and adults 1/3. Obesity for adults is having a body mass BMI of 30 or higher. For children, their body composition is different, so it is BMI at or above the 95th percentile. Being obese is a very costly disease that is associated with cardiovascular. It impairs work productivity with an increased medical cost. For weight loss, physical activity and diet is very important. There are surgical and pharmacological interventions that should only be tried after behavioral changes. Cardiovascular disease is also well known to patients suffering with post-traumatic stress syndrome, more so than those without it. We all know that poor health behaviors are the main causes for diseases such as diabetes and cardiovascular disease. To prove the association between PTSD and cardiovascular disease, according to the research, based upon 1,349 studies, proved that 5% of people who have poor diets were individuals suffering from PTSD, with only 9% who engage in any form of physical activity. Moving forward to cardiovascular disease prevention. Modification of risky behaviors is required to combat cardiovascular disease. Behaviors such as high-fat and sodium diets, cigarette smoking, and caring for existing diseases is important. The psychosocial smoking prevention programs of today have been successful at preventing smoking by 40 to 70%. In a study done on junior high students that were smokers for 5 years. Eating and physical activity programs have proven to be a success at enhancing knowledge and having the desires to exercise and eat healthy. Cardiovascular disease and insomnia. Insomnia is a well-known sleep disorder that many believe is a trigger from psychosocial factors such as stress. Adults who suffer from insomnia have issues with autonomic nervous system pathophysiology. These individuals will show a reduced heart rate, elevated body temperature, electrodermal activity, and clinical and non-clinical samples. A higher heart rate would indicate a healthy cardiovascular autonomic function versus a lower one. For individuals who currently have a lower heart rate, it can trigger cardiovascular disease and cause it to progress. Insomnia untreated can increase the chances of developing cardiovascular disease in the future. According to the research, there have been several studies to show higher and lower blood pressure. Moving forward with insomnia intervention. There are evidence-based interventions for insomnia, known as cognitive behavioral therapy and pharmacotherapy. Pharmacotherapy consists of different medications that will affect the brain and rapidly combat insomnia. Cardiovascular disease in family. Family is very important even for cardiovascular disease. It has been demonstrated through a large body of research that it influences better health. Having a social support has been proven to show improvements for many illnesses. It has been reported in a study of Israeli men who were loved by their wives. They had less angina pectoris. In the study beta blocker after heart attack trial, this consisted of men who were under higher stress levels and isolated socially. They had higher death rates. Moving forward to cardiovascular disease advances. In the last 20 years, the mortality rate from cardiovascular disease has decreased by 30%, and the mortality from stroke has also decreased more than 45%. 335,000 people who would have died back in the 1960s did not die, according to the mortality tables of 1960. Economics. The advances of cardiovascular disease has benefited the nation by $100 billion. Since 1948, The total expenses for the Heart Institute is now less than $5 billion. The success in economics and the decreased rate of mortality stems from several factors. It stems from the success factors that have improved the disease, are the advances in the drugs, improvements in surgical procedures like coronary artery bypass, therapy, and diagnostic methods. The new clinicals and fundamental studies with behavioral changes have paved the way to make it possible to prevent cardiovascular disease. Still, cardiovascular disease is the #1 killer in the United States, which is why so many refinements are needed. Living with heart disease. Further research on the quality of relationships will give a better understanding of how intimate relationships are affected by heart health. There are many couples who are coping with the illness, in which this disease has affected their relationship, with not being able to function as before. When individuals have decreased function, it can cause both partners to feel sad. There are many normal activities that individuals with heart failure can no longer do, such as driving and traveling as they please. Heart failure individuals have symptoms of tiredness, feeling isolated, and misunderstood when one spouse is contributing to the majority of the responsibilities in the home. At the same time, there are couples who don't have a problem with adjusting to experiences of cardiac experiences. Those couples will notice a positive change in their relationship and feel closer. Healthy living. Individuals who have a family history of heart disease are at a much higher risk of developing this disease themselves. Individuals with a family history of coronary heart disease, only 25 to 30% of them receive counseling for lifestyle modification. A healthy heart diet is going to be high in fruits and vegetables, fish, lean meat, whole grains, and low in saturated fats and cholesterol.